how to be seated. Also make a choice about your hand placement. By now you know sort of the options. Palms down tends to be a little bit more introspective. Palms up tends to be more of an invitation for inspiration. You could bring palms to the heart, whatever feels comfortable for you. And then make a choice for this moment about how you want to place your eyelids. Maybe you close them all the way. Maybe you have them at half mast. Maybe you have a downward gaze or drishti. And then welcome in the reality of this moment as you continue to settle into your seat. Perhaps you start by inviting your body to consciously arrive in this seat, grounding itself into the earth, maybe growing imaginary roots, and then noticing the rebound of the earth as it provides support, and maybe even a sense of upward energy that supports an expansiveness through the heart, through the spine, and the crown of the head. And at the center of this grounding and expansion, you might notice a sense of stability as your body just naturally calibrates itself into this upright position. And today, since this is a pranayama practice, particularly check in with the natural curves of your spine. And make any adjustments throughout the time that we're seated to prevent, to the best of your ability today, any slumping forward, which tends to restrict the breath. So embracing your natural curves in your spine and inviting a fairly open-hearted posture without over-efforting. And once you're satisfied that your body has arrived at the reality of its moment in time, you can hold it in your awareness so that you can be sure that your body will signal you when you need to make little adjustments or movements to invite greater effort or greater ease, to maintain that natural curve, to maintain the sense of grounding, expansion, and stability. And while you're holding your body in awareness in this way, gently bring your attention to your breathing. And this is all you're doing. You're attending to the reality of your breath in this moment. There's no effort to change it. There's no inclination to judge it. There's simply an invitation to be present with how the inhalation is moving in and how the exhalation is moving out in a very natural and quiet sort of way. There's really no need for us to worry about our breath because our breath moves through us automatically. There's a lot of sensory feedback that arrives from your body through the phrenic nerve and the vagus nerve in your brainstem, in the medulla oblongata, to give feedback about any adjustments that are necessary. This does not require any conscious control from your prefrontal cortex. And so you can truly observe your breath with an easy mind and an open heart. Just noticing what's present and being with the unfolding of your breath moment to moment. Your respiratory system is very perfectly designed to create a very auspicious and healthful breath. Your inhalation starts in the nose. You might notice this right now as you're breathing in, as air travels into the nose where it is warmed and moistened and cleansed by various special features that are present only in your nose, not in your mouth. The blood in your nose warms the air. The mucus in your nose wets or moistens the air. And the cilia, or little tiny hairs in your nose, cleanse the air. And the structure of your nose is such that the air moves through your nose like through a turbine, so that the flow of air is actually slowed a bit in the nose as it travels into the lungs. And so there are various functions then that happen in the nose that don't happen in the mouth, that suggests that breathing in through the nose in the long term has more healthful benefits than breathing in through the mouth. You also might notice once the air has moved through the nose, you can feel a trace of the in-breath at the back of your throat, your pharynx. From there, the air travels past the larynx and into the trachea. The trachea is the tube in your throat that moves the air into the lungs. And so whether the air comes in from the nose or the mouth, it will ultimately reach the trachea. And so as you follow the flow of your air in through the nose and through the throat, you might then note that the trachea splits into two bronchi, air tubes that move into each side of your lungs, one to the right, one to the left. And so you might even envision, as you're investigating the reality of your breath in this moment, how the breath moves in through the nose, through the pharynx, past the larynx, into the trachea, and then divides, the airstream divides into a right and a left half, moving through the bronchi into the two sides of the lungs. 3 lobes of your lungs on the right side and 2 on the left. At the level of the lungs, the bronchi split into bronchioles. You might envision, as you're breathing, an upside down tree, where your trachea is the stem, the bronchi are 2 large branches, and then the bronchioles are lots and lots of little branches. that keep dividing and dividing into a structure very like the top of a tree. Each bronchiole ends in alveoli. Those look like little grapes at the end of each bronchiole. And this is where the actual contact is made between your breath and your blood. At this very, very tiny, tiny junction of the alveoli, where oxygen is taken up by the blood and CO2 is released back into your airstream so that then the air can travel out in the opposite direction that it traveled in, moving from the alveoli into the bronchioles, and then the bronchi and the trachea, past the larynx, out the nose, or out the mouth. And nature, once again, has constructed things so that breathing out through the nose is a tiny bit more auspicious than breathing out through the mouth. Because as you breathe out through the nose, the air that has come from your body actually supports the warmth in the nose. It remoistens the nose. And the outflow of the breath cleanses the toxins that the cilia collected as the air traveled in, so that these same toxins are now expelled with your out breath. So as you sit here quietly watching the reality of your breath, you might continue to hold this image of your upside down tree receiving air, exchanging oxygen for carbon dioxide, and then expelling air back into the outer world. A perfect system of respiration. Perfect system for bringing healthful nourishment into your body and for releasing what no longer serves. Take a few more rounds of breath, gently, quietly, and naturally. Honoring this journey of the air through your airway. At the end of your next breath cycle, if your eyes are lowered or closed, go ahead and lift your gaze. Blink your eyes open. And bring your focus back to the outer world. Not abandoning your breath, but keeping it in your awareness as we change positions to experience a little bit more of the breath in a slightly different way. And so this is where your props come in handy. You can hopefully see what I have on my mat here. So for the upper part of your body, you'll be on your back. It'll be helpful to have a blanket sort of on the upper half of your mat, and then a second blanket or a bath towel, or even a little pillow or something that is in part superimposed on the lower blanket, but then makes kind of a cushion for your head. And I'll show you in a moment. I'll lie down so that you can see. And then for the lower half of your body, you'll need a bolster. And if you have a round bolster, you won't need a block. But if you have a bolster like I do, or a cushion, you want the block so that you can angle the bolster, because your legs will hang over the bolster. And so you want to create like a little slope for them that's nice and soft. And then have a rolled blanket or a rolled towel or something that your feet, really the back of your ankles, can land on. And so I'll show you what this looks like when you actually lie down on this, because you'll have to adjust it to the length of your torso. You'll have the edge of the two blankets in your low back. So that's where you start. And then you have this cushion-like fold of the upper blanket under your neck and your head, so that your throat is slightly flexed. And then you drape your legs over your bolster so that the soft round edge is under your knee, under the backs of your knees. And then your backs of your ankles rest on the blanket, or they could rest on a block or a towel, just something. You don't want them to hang in the air. So the idea is that all of your major joints, as you're on your back here, are flexed. And if you want to, you could even have a support under your wrists. It could be your two blocks, so that even your elbows and your wrists are flexed, and your fingers could slightly curl in so that even the hands are flexed. So that you're lying in this very natural, relaxed position. And so do really feel free to take the time to settle yourself in, just so that you feel really comfortable and supported. Maybe so supported that you won't even feel the need for any adjustments as we move through the next portion of our practice. And if you don't have any of these props and you just need to lie flat on your back on the ground, you can absolutely do that. The only thing I then recommend is that you take something to bring under your head so that you have this slight compression in the front of the throat, and that you have something under your knees so that you have a little bit of flexion in the hips and in the knees. But if you can do the full setup, give yourself the joy of that. And then, of course, if it's for whatever reason not comfortable for you to lie down, you're also welcome to stay seated. And once you've settled yourself into your shape, make a conscious decision about what feels auspicious for you in terms of how to place your eyelids. Again, choosing either to close the eyes or to lower your gaze, bringing the eyelids to half mast or almost closed. Know that your body will remain in your awareness, and if there are signals from the body that you need to adjust, you will receive them and you will be able to make accommodations. And then once again, bring your attention into your breathing, reconnecting to your quiet breath, your natural breath. Maybe even remembering that image of the upside down tree as breath continuously moves in and out of your body. Taking your time to really appreciate and note the reality of your breath in this moment. And receiving that reality with curiosity and without judgment. And from here, gently bring your attention to your abdomen. Perhaps the region around the belly button. If you would like, you could even bring a hand there, but it's not necessary. It's your call. And as you bring your attention to the abdomen, take care not to alter the breath to create sensation here that wasn't naturally present. But instead, simply tune into the reality of what is happening in your abdomen, if anything, that you can sense from the inside out. And if you have your hand there, even from the outside in. You may or may not notice a slight movement of the abdomen, where there's a pulsation outward with the inhalation and a pulsation inward with the exhalation. This may be more or less detectable in your own anatomy. And so again, receive whatever feedback is coming in from your body with an open mind and an open heart. The movement you feel here is largely due to the movement of the diaphragm. Which is a cone-shaped muscle that divides your thoracic cavity and your abdominal cavity from one another. In the yoga world, you might hear the thoracic cavity called the air body and the abdominal cavity the water body. And so the diaphragm divides those two parts of your torso. And the diaphragm is really shaped like a double dome. There's one dome under the right and one dome under the left sets of lobes of your lungs. And if you feel a little bit of movement outward in your abdomen, when you inhale, what you're feeling is the diaphragm contracting and moving downward. The centers of the two domes are moving downward. And this may very slightly displace the organs in your abdominal cavity, and this is what you're feeling as a slight movement outward of the abdomen as you inhale. If you also notice your abdomen moving inward with the exhalation, this is your diaphragm relaxing back into its original position. So that now the organs too can return to their original place. And quiet breathing, which is all we're doing right now, is quietly and naturally breathing. There's not much other muscular action going on that you could sense in your abdomen. The abdominal muscles do not have much to contribute to quiet breathing. If they do anything, they might relax slightly as you inhale, and they might contract ever so slightly as you exhale. There's no extra calming to be gained from making the movement of the abdomen any more pronounced than what happens naturally in the reality of your body and in the reality of your breath. And so patiently and kindly, simply notice what is happening in your abdomen in this moment, and receive that feedback with an open heart and an open mind. At the end of your next breath cycle, gently draw your attention slightly upward to the bottom part of your rib cage, your rib basket, the lower set of ribs. And just as you watch your abdomen with curiosity and without any kind of preconceived notions or judgment, notice what happens in terms of movement here as you breathe quietly and naturally at this lower part of the rib basket. Technically from ribs 6 on downward. If you wanted some external feedback, you could place your hands around that bottom edge of the rib basket, at the sides, to maybe have a little bit of extra feedback about what's happening here. And what you might notice is a slight outward and upward expansion of your lower ribs, lifting up and out like little bucket handles. But not to worry if you don't have a sense of that at all. Just notice what the reality of the breath is for you in your body as you're placing all of your attention to the lower basket. This movement, too, is largely due to your diaphragm. The diaphragm is a fascinating muscle in that it switches origin and insertion So its attachment points midstream. On the inhalation, as the diaphragm meets the resistance of whatever is in the abdomen, maybe just the organs, maybe a baby, maybe a full stomach, it actually inverts and now moves the lower ribs, creating that outward and upward movement that you can sense in your lower rib basket. Those centers of those domes of the diaphragm really can only descend so far before the organs stop them. And then at that stopping point, the origin and insertion of the diaphragm flip. And the edges of the diaphragm pull up on your lower ribs. Expand the rib basket to make more room for air to travel in. This outward and upward movement of the lower rib basket is also supported by your intercostal muscles. The external intercostal muscles, so those that are toward the outside of the ribs, between the ribs, contract as you inhale, supporting or assisting the diaphragm in creating this outward and upward movement of the low rib basket. And then when the diaphragm relaxes and flattens yet again during the exhalation, the internal intercostals contract to draw the rib basket back in and downward. Assisting the diaphragm in reducing the size of the thoracic cavity to support the flow of the air out. Continue to be attentive to this movement at the lower rib cage. Maybe appreciating with a little bit more clarity now the amazing collaboration of the diaphragm and the small muscles between your ribs to increase the size of the thoracic cavity so that air flows into the vacuum that's created in your lungs through this increase in size, which decreases the pressure in the lungs, which allows air to be sucked in. And then perhaps notice with a little bit more clarity how the diaphragm and the intercostals collaborate to reduce the size of the thoracic cavity, increasing pressure so that air is transported out. For most natural and quiet breathing, this is all that happens. If you would like to explore further, you can move to the third part of the breath that may exist by drawing your attention upward to the top portion of the rib basket, perhaps all the way to the clavicles. You could place your hands there, placing them at the top of the rib cage, maybe the index fingers, tips of the index fingers even feel the clavicle underneath them. And then notice if there is movement in this part of your rib basket. Even here, you might have a sense of outward and upward movement under your hands, if your hands are there, or you might perceive this just through interoceptive feedback as you place your attention into the top part of your chest. Now you're feeling the action of the intercostal muscles of ribs 1 through 5. This may be a very subtle expansion and contraction. If it's a relatively profound and noticeable expansion and contraction, it's possible that other muscles are active in your body in this moment as well. Your sternocleidomastoid muscles, your pecs, your scalenes, they may help with lifting the rib cage. And opening these upper ribs. And so just notice the reality of your breath in this moment. The movement in the upper chest is not created by the diaphragm. It's created by these accessory muscles. And it may or may not be present in your natural quiet breathing. It does tend to be present in a forceful or anxious or slightly agitated breath. So just notice what is showing up in your reality of your breath in this moment. Remembering yet again to meet whatever shows up with an open heart and an open mind. Quiet, natural breathing is by definition slow and calm. It calms our nervous system. It calms our mind. And it's the very opposite of forced breathing or deep breathing, which can actually dysregulate our nervous system. And so in the early stages of pranayama, we really favor slow, conscious, natural, quiet breathing over deep breathing or forced breathing. At the end of your next breath cycle, gently bring yourself back to the outer world, drawing your attention outwards, opening your eyes, And preparing yourself to come to a seat, just as a transitional shape. Trying to make the transition, staying as quiet and calm as possible. And preparing for coming to your belly. So I'll show this next setup. You'll again need a blanket. Actually, you'll need 2 blankets. So grab one of your blankets and bring it into a shape like this, kind of like what we sat on at the beginning. You can move the other second blanket away, and then take a second blanket that's rolled. You could use the one that you had under your ankles, and bring that to the bottom of the mat, and bring this flat folded blanket to the top. This will hold your forehead. This will hold the tops of your ankles, and then the bolster will hold your torso. You could add more blankets or soft pillows, additional cushions to the bolster if that feels more comfortable. You could also lie on a couch. The nice thing about this setup is when you drape yourself now over this bolster, the tops of the ankles come on the rolled blanket. We never want floating feet in pranayama. The torso comes onto the bolster. The forehead comes to this blanket so that now your face has an opening so you can breathe freely. It's a little bit like a massage table setup, and it actually works really great as a setup if you have somebody who can give you a massage in your home. And then decide how you want to place your arms. You have options here. You can drape them along the side of your body, or what I prefer is I like to bring them up to the side of my top blanket. You'll have to experiment what feels better for you. And then gently let yourself settle into this particular position. I won't keep us here quite as long as in the supine position. So if this feels a bit constricting for your belly, you can either bear with it, or you can always come back to a supine position, or you can come to a seat. Or you can see if you can work with this for a bit. We're intentionally compressing the forward portion of the body. Most of the time when we're seated or supine and we attend to the breath, we attend to the front body. But the reality is, and you might have noticed this in paying attention to the breath in your rib basket, that the body actually expands in 360 degrees. And so as you're on your belly here, consciously feel your breath, your quiet, natural breath in the back part of your lungs. 60% of your lung mass is in the back body. So there's a lot of room for the lungs to expand backwards. So typically when we constrict or restrict the movement of the abdomen or the rib basket in the front body, more movement will begin to happen in the back body. This is great for creating resilience in the rib basket. Maybe also notice the expansion of the rib basket at the sides, so that you can yet again feel this bucket handle movement of the rib basket expanding outward and upward, this time with a primary focus on the back body. Feeling the expansion of the rib basket to the back and to the side. Feeling the side waist expand. If this is the first time you have worked interoceptively with breathing into the back and side bodies, you may not sense much. That's okay. Just trust that there's movement happening here. And that in time, as you take more opportunities to pay attention to creating this resilience in the back and side of your rib basket, you will feel more and more movement here. Creating resilience in the rib basket is one of the best things we can do for our quiet, natural breathing. We can actually overdo abdominal breathing, over-efforting in that region, when really creating resilience in the rib basket over our lifespan may be more advantageous. Because it's the rib basket that tends to stiffen. In fact, the rib basket in age can get stuck in the inhalation position, so that it becomes difficult to exhale. And when you can't exhale very well, because your rib basket has become stiff, there may be a buildup of CO2 that leads to breath hunger, and yet more breathing doesn't help, because it is the lack of complete exhalation that's the problem. Take just a few more rounds of breath here, sensing into the back and side body. If you can feel it, imagine this expansion, this resilience in the rib basket, moving outward with the inhalation and drawing inward and downward with the exhalation. And if you ever want to do this and experience this with a partner, they can place their hands on your back body and can give you feedback about how much movement they feel at the top, the mid, and the side sections of your rib basket, helping you learn direct the breath to places that maybe aren't moving as much as they could. And then at the end of your next breath cycle, prepare yourself for returning to an upright position. So you might bring the hands under the shoulders and press out through a tabletop, and then maybe coming to your heels so that you can remove the props from your mat. For the time being, we will need them again as you come to standing. And while you will stand, I'm going to come to my knees so that I'm not a headless yoga teacher. I'd rather be on my knees than you not see my head. Plus the important part here is the movement of the arms. And then come to a comfortable standing position. As we take a few breathing movements here in this particular body shape to really give you a sense that pranayama can happen seated, lying on your back, lying on your belly, standing up, and even walking, though we won't do walking today. And begin to move with your breath through a few rounds of sun breath. Sun breath being inhaling as the arms lift and exhaling as the arms lower. You can lower them either to your side, or if you prefer, you can bring the palms together and draw them down through your central channel. This is completely up to you. You could experiment with both and see what feels better for you. And don't mimic my movement. I'm talking, so I'm breathing quickly, but instead move with your quiet and natural breath that you've cultivated for the last 40 minutes or so. So your movements might be nice and slow and very luxurious. And as you sun breathe here, remember again the pathway of the air through the nose, the pharynx, past the larynx, through the trachea, into the bronchi, into the bronchioles, to the alveoli where the gas exchange takes place. Knowing that you can sense the breath at this very most subtle level of gaseous exchange in the alveoli, at the same time that you can also feel the breath as you move your arms up and down, supporting the expansion, upward movement and outward movement of the rib cage. And maybe the expansion of the abdomen as you inhale, and then the opposite as you exhale. So bringing all of our imageries and visualizations and experiences into this more vigorous practice. And then if you'd like even more movement here to notice how movement affects the breath, you could add a side bend, exhaling the body to one side, inhaling it to center, exhaling to the other side, and then noticing how this yet again shifts the breath because you're shifting your anatomy, you're compressing one side of your rib basket, even though you're inhaling or exhaling. And so just notice how this shifts, where you feel your breath in your rib basket, in your abdomen. Maybe you feel more clavicular breathing high in the chest when you add this kind of movement. Just really pay attention to your anatomy from the inside out. And get creative here in any movements that you want to take. Sun breath, side bends. You could also begin to add some twists. Using your own discernment here of how you want to explore the breath in movement. And then begin to notice if your breath rhythm is just naturally changing as your activity level becomes a bit more vigorous. Your body has a slightly different need now for gaseous exchange. And so it will adjust your breathing rhythm based on feedback from a variety of sensors in your respiratory and your circulatory system. You have chemoreceptors that are sensing your CO2 levels. And if they get too high, they will trigger an inhalation. Your phrenic nerve and your medulla oblongata just take care of that for you. You don't have to make a conscious choice about this. So as CO2 levels rise, there is a triggering of an inhalation. And so you may notice that as you move more actively, you have more need for frequent breathing, or you may have a need for still slow breathing, but deeper breathing. And so just notice. And then there are baroreceptors, receptors of pressure in your arteries that notice if there's too much pressure in your arteries. And then they will trigger an adjustment to decrease the pressure in your arteries, either slowing things, or if there's not enough, speeding things up. So just know that that's happening too. And then there are stretch receptors that also give feedback to your respiratory and circulatory system about the need for a changed breath rate, depending on what's happening. And if you've gotten really active and you've made yourself kind of hot and sweaty because you decided to move rather vigorously, your thermoregulation system may speed up your breath rate to help cool you. And so there are all kinds of receptors and sensors in your body that give constant feedback to your medulla oblongata to adjust your breathing speed, your breathing rhythm, and then the palms will actually smooth the texture of that breathing rhythm. So beautiful autonomic function of your breath. There's nothing much you need to do. And if you're still moving quite a bit, move toward more stillness, maybe taking just a couple more rounds of sun breath. If you feel balanced enough standing, maybe you take a couple of these with your eyes closed or cast downward. Supporting a return to a quiet breath. A natural breath, a slower breath rate. And then finally come to standing with your palms at your heart, maybe in a prayer position, maybe palms flat on the heart, and feel your own heartbeat for a moment. Noticing very directly the impact of movement on your breath rhythm. The volume, the rate, the texture, even the location of your breath. Maybe there's a bit more movement right now in the abdomen and the rib basket than when you were lying still. And as you stand here, hands at your heart, you might have the privilege of noticing how your autonomic nervous system is slowly re-regulating your breath rhythm, movement having stopped for the most part. The breath can quiet. The breath can calm. And then gently release your hands. And once again, find your way to a supine position. You can use the same setup that we had earlier, where you had a blanket at the top half, and then another blanket on top of that blanket to create that double layer for the low back, and then the pillow-like layer for your head and neck, the block and bolster, or however you set it up the first time, and the rolled blanket for your feet, or you could choose any other supine position. Make it a supine position that feels comfortable for you. You're going to be here for quite a while. Of course, you know you can always rearrange. We will take one final breathing practice, pranayama practice in this position, and then we will take a very extended post-pranayama shavasana. And so we won't change positions in between the final pranayama and the shavasana. So whatever position you choose, choose something that feels comfortable for you for shavasana. So you might even want a blanket on you or socks on your feet, just something so that you can feel warm once you're moving into shavasana. Not that it's cool necessarily in your room. And if you like to have shavasana with complete darkness, you might want to have a little washcloth or something that you can place over your eyes. So one final pranayama practice and then moving directly into shavasana. So choose wisely how you want to position yourself. And once you have found your preferred supine position, very consciously resettle your body and take a moment to attune to the reality of your body in this moment. Making adjustments and auspicious decisions about how to place your various body parts. And then know that your body will remain in your awareness. So you will know when you need to adjust, and you're always free to do so. And once your body feels settled, gently draw your attention yet again to your breath. And once again begin by simply noticing the reality of your breath in this moment. Knowing that you're inhaling while you're inhaling. Knowing that you're exhaling while you're exhaling. Breathing naturally and quietly. Maybe having somewhere in your awareness that picture of the upside down tree. Maybe having somewhere in your awareness that knowledge now of how the abdomen moves, how the diaphragm moves, how the rib basket moves, how various other muscles support the diaphragm. And then become curious about how long it's taking you to inhale and how long it's taking you to exhale. Maybe you count how many beats it takes you to draw the breath in and how many beats it takes you to release the breath out. Or maybe you just get an intuitive sense. And then without judgment, simply with curiosity, compare the length of the inhalation to the length of the exhalation. And just notice if they're about equal or if one is longer than the other. And then find your method for equalizing the length of the inhalation and exhalation. You might shorten the longer one if they were different, or you might lengthen the shorter one, or you could do a little bit of both. Sometimes counting is helpful, but there may be other ways that you prefer for measuring the inhalation and the exhalation. And then as you equalize the breath, especially if you had to make quite a bit of adjustment to create equal breathing, notice the effect of that on the level of effort or ease in your breathing. Is there any sense of air hunger, gasping at the end of the exhalation? Just notice how this slight potential change in the breath is affecting your nervous system, your mind, and maybe even how the breath is moving and feeling in the body in terms of location or texture or effort or ease. Ultimately, through pranayama, we try to slow our breath rate to about 6 to 10 breaths per minute. The average rate of breaths per minute is pretty variable across people, but it ranges from about 9 to 24 breaths a minute. And so, generally speaking, pranayama helps us slow over time our breath rate to somewhere between 6 and 10 cycles of breath per minute. And what this really does for us is create greater tolerance of higher CO2 levels. It's our CO2 level that triggers the inhalation. And so the more tolerance we have for a slightly higher CO2 level, the longer we can wait before we inhale yet again. And so the urge for breathing really does not come from a need for oxygen, but it comes from too much carbon dioxide in the blood. your oxygen saturation in the blood does not actually change very much. It is quite stable. That's quite necessary to support your life and the functioning of all of your tissues and cells. And so pranayama increases our tolerance for higher CO2 levels. If you're still breathing in a one-to-one rhythm and that was a big adjustment for you, come back to your natural breathing. This one-to-one ratio of inhalation to exhalation has been shown in the research literature to have the greatest benefit for heart rate variability. So we don't actually need to extend the exhalation beyond the length of the inhalation to have benefits for heart rate variability or for our nervous system or our mind. This type of breathing, this ratio of 1-to-1 in Sanskrit is called samavritti breathing. Equal fluctuations. And now even move beyond natural breathing or quiet breathing, just surrendering your breath to your autonomic nervous system, to the flow of prana through the universe, however you want to frame that. Letting go of curiosity, letting go of control, surrendering to the greater flow of energy within your own body and around your own body. And at the same time, surrender your body to gravity, letting yourself ground and root through the earth without any effort. Inviting a sense of ease, but being fine with whatever is. And then also surrendering your mind, surrendering any clinging or grasping that may happen as you latch on to thoughts or plans or judgments or anticipation. Just knowing that thoughts are like clouds passing through the sky, coming and going on their own. And that beneath those clouds, there's the spacious awareness that brings peace and calm. And from this place of surrender, we will now move into 10 minutes of silent shavasana. This will seem like a very long time, so just trust that I will bring you back after 10 minutes. And let yourself surrender to the quiet, the calm, and the stillness of your final resting pose. very gently begin to draw your senses outward. Once again, becoming aware of your surroundings. Maybe noticing the sounds around you. Noticing the air on your skin and the ground beneath you. Might even blink your eyes open for a moment if they were closed, to take a visual image of your environment. And then as the senses increasingly awaken to the reality of this moment, also begin to awaken your physical body. Maybe stretching or wiggling or moving in any other way that feels intuitive to you right here, right now. And then breathe a conscious round of breath, knowing that you're inhaling when you're inhaling and that you're exhaling when you're exhaling. Check in with your mind for a moment, just noting whatever thoughts are present. Noticing any reverberations of the practice in your mind. And then prepare yourself for a transition to a seat where we will all meet to close this practice together. I invite you to find an auspicious position for your hands as you bow your head to your heart. Allow yourself another conscious round of breath, not a deep breath, but a natural breath, a quiet breath. A breath of peacefulness, a breath of harmony, and a breath of compassion for your body, your energy, and your mind. And as you take in this breath, notice if there is a merit that arose for you from this practice today. And make a choice whether you might want to send that merit out into your world or to anyone in particular or to yourself. All perfectly fine choices. And then with one more conscious inhalation, seal the merit from your practice into your own heart. And send it out as you chose with your exhalation. As always, thank you so much for sharing this practice. It's an honor, a pleasure, and a joy to share this yoga journey with you. Thank you.